So today I'm going to do my Instagram live outside, really because I'm in London and it's the quietest place to find. But I'm going to be talking for the next half an hour about holidays and what to do if you're taking hormones or if you're not taking hormones and you're going on holiday. So I've had lots of questions, so thanks so much for asking various questions and I'll try and go through them. So when we have hormonal changes, whether it's perimenopause, menopause, PMS, PMDD, it can affect us in so many different ways. And when our hormone levels are fluctuating or when they're low, it can cause a myriad of symptoms. But as many of you know, the commonest symptoms are the symptoms affecting our brain. So anxiety, low mood, memory problems, poor sleep. Now, if you're trying to pack and think about a holiday, and if you're like me and have 3 children and a husband who only really thinks about which shoes he's going to take, it can be really frustrating because it can be quite overwhelming. Thinking and planning, and certainly if you work, if you've got pets, if you need to be thinking who's going to be feeding the pets when you're away, who's going to be checking on your work, what about all the emails that come in when you're away, how are you going to catch up? It can be quite difficult, and a lot of people I speak to actually say they don't enjoy going away like they used to. They feel the thought of even packing a suitcase or thinking about what to pack fills them with a huge amount of anxiety that they never had before. And it's often not until they put 2 and 2 together and realise they've got other symptoms that they realise this isn't just because they're getting older or they're going to a different place on holiday. It's really because they've got hormonal changes that are affecting them. So the holiday might be a time when you're thinking, could I have any hormonal changes that's causing me to be more anxious or more forgetful or more worried or just not quite as excited as perhaps you have been on previous holidays. So any time that we have to reflect and think about our symptoms is really important. And if you've seen today, it's actually a 4-year anniversary since I developed Balance app, the free app, which is always going to be free. And one of the reasons I developed it because I was so frustrated that I didn't recognise my own symptoms, and it took me quite a few months of suffering actually before I realised. But if any of you are experiencing symptoms, you might be thinking about going on holiday or you've got a holiday coming up and you haven't realised that you might be having hormonal changes, it's a time to think about something like balance, thinking about the questions, thinking about symptoms, and just having a bit of time to yourself to think, what's going on in my body, what is changing, and how can I think about what treatment choices I want. So a lot of people have asked about what to do if they're on hormonal treatments and what happens when they go away. And one of the commonest questions is about hand luggage. Can I take my HRT and hand luggage? And actually I will share some resources, and we've written some information that I'm hoping you'll all find really useful on the Balance website. But actually, as you know, it's 100 mL maximum in most places for fluid and liquid. The estrogen gel is 80 millilitres. So absolutely you can take it on hand luggage. It can actually though cause questions for sometimes. I've certainly been stopped before and people have said, oh, what's this in your hand luggage? But it's absolutely fine. So having patches, gels, absolutely fine. The progesterone, absolutely fine. Pessaries, absolutely fine in hand luggage. Testosterone is more of an unusual one because it's actually it's actually down as a can't even think today. Sorry, it's down as a controlled drug. And this is because there was confusion actually when anabolic steroids came out, which are testosterone-like substances. Testosterone actually isn't an anabolic steroid to the same extent that the synthetic hormones are, but it is down as a controlled drug, which means that for some people, and it's really vague what the rulings are, that you might have to take a copy of your prescription. So I've never been stopped or questioned, but if you are going to some countries where you think it might be more of a problem, or you just want to be extra careful, then it might be worth taking a copy of your prescription or a copy of your clinic letter. Anything that you prescribed will have your name on, so it's obvious that it's been prescribed for you as well. But it's absolutely fine, and actually having all these products in your big hold luggage is absolutely fine too. Some people worry about the temperature. Now usually the creams and the gels are fine at room temperature. If you are going somewhere very hot, that doesn't have air conditioning, then there's no harm keeping it in the fridge, but you don't have to. It just depends on what you can access, and it's unlikely that it's really going to cause many problems if it is warm. But if it's somewhere that's incredibly hot, then it might be safer just to put in the fridge. Now, people have asked about absorption of patches and gels when they're in a hot climate or even a cold climate, and many of you know the absorption of estrogen through the skin is incredibly unreliable. It's quite a crude way actually of getting estrogen through the skin, but it's the best way of having hormones because it keeps the natural estradiol, the good anti-inflammatory estrogen, going into our bloodstream. So some people find when they're in hotter countries, the heat of their skin means that they have more vasodilation, which means that the blood vessels come to the surface more. The skin is warmer, of course. The blood vessels are larger because they're dilating. They're trying to cool down the core temperature. But that means that the blood vessels are nearer the surface of the skin. They're dilated, they're larger, so it's easier for the estrogen to get into the bloodstream. So some people find that they get symptoms, either they feel better or they might feel slightly worse, depending on whether they need their estrogen dose changing or not. So if you do that, if you're on patches and you feel that you don't feel as well, it might be because you're absorbing slightly more, in which case you can cut a corner of the patch off to have slightly less. Conversely though, some people find that their patches don't stick on so well, especially if their skin is sweaty and very warm, or you might find that you've got more irritation under the patch. So if you are finding the patches aren't sticking on as well, then it might be that you're not quite absorbing enough. So you have to be really careful and just try and be in tune with what's going on with your body. When you apply the patches, make sure the skin is really dry and really clean, and just sometimes pressing on the patch for a little while, trying to get the glue to really stick to the skin before you put your clothes on can be really useful. Don't do like I did. I've just come back from Croatia and I was wearing a bikini, and I don't normally wear bikinis, and so my patches were quite high up on my back. So I was looking in the mirror and thinking, oh, I can't go out like this because I look like a patchwork cushion. So I spent a long time scraping off the glue from the outside. And some of you might know that can be quite painful actually. There are different wipes that you can get, but of course I didn't take any on holiday with me. So I was using a dry flannel, which is often quite a good way of getting it off, but it's painful. So I got lots of red marks on my back. Really pleased that my back was nice and clean. Went out in my bikini, had a swim. And then later on in the day, my children were saying to me, Mummy, what's wrong with you? You're not right. What's the matter? I was like, I'm fine. I think I'm all right. He said, no, you're not. You're not yourself. You're just a bit distant. And then later on in the evening, I was feeling around and I said, oh no, I didn't put my patches on. I was so preoccupied with getting the glue of the patches off that I forgot to put new patches on. And I use more than one patch because my levels of estrogen are very low if I only use one patch, and the patches don't really stick on that well, so I don't absorb enough for me. So it was very interesting but really disconcerting actually, because I was out all day, so I couldn't get my patches until far later in the evening. But I could notice a difference in me just not having patches for 12 hours or so, and it just shows how quickly estrogen in the patches wears off. Like, it doesn't build up in the body, and that's something that's worth bearing in mind, because when people are worried about estrogen, you always can be reassured that it doesn't last long in the body. So make sure that you don't do like me and get so preoccupied with how your patchwork looks if you're wearing patches on your back or your thigh or whatever, that you do reapply. Now, some people will go to areas where there's a big time difference, and they might say, oh, what am I going to do then with the time difference? It doesn't really matter as long as you can use it within 24 hours. And it might be that you have a day where you're theoretically using it twice in 24 hours, or you might be using slightly less depending on the time zone, and that's absolutely fine because it will average out. When I used my patches, I was like a good 12 hours out of sync, but I'm quite routine-y, and I always change my patches on a Monday and a Thursday. So being a sort of a day out I still change my patches again the following Monday, because otherwise if I started going Friday, Tuesday, then I know I'd forget, and that's just a personal thing. So it doesn't matter if you forget, just try and go back into what you were doing before. With the progesterone, some people are concerned because progesterone should be taken at night time, of course. And I say of course, it's not always obvious why we say take it at night time, is it? But usually it's because it can make people feel more relaxed. It can affect something called GABA in our brain and help with our sleep. And so a lot of people prefer to take it at night time. Some women I've spoken to say that it doesn't affect the sleep in any way whatsoever. And in which case, it doesn't matter when you take it any time that you like. If you've forgotten to take it, or you're going to a time where it's going to be more than 24 hours since you've taken it, it doesn't matter, just take it when is right for you. But you just be aware that if you've missed a day or two, you might get some bleeding when you take the progesterone, which is quite common. So any changes in estrogen, progesterone doses can trigger some bleeding, and if it's light, it's not troublesome, it doesn't last very long, then you don't need to be concerned about it. So it's just worth bearing in mind. Thinking about bleeding though, no one really wants to have a period when they're on holiday. And so there are some women that take cyclical HRT, which I've spoken about before, where you have progesterone for 2 out of 4 weeks. Now, if you're falling into the time where you think you're going to have a period, what you can do is carry on taking the progesterone. So you can take 2 at night for a whole month, and then you can stop taking them when you come home, and you're more likely to have a withdrawal or bleed then. And it's quite fine to take your progesterone for a longer period of time. If you're taking one progesterone at night and you do find that you have some bleeding, and as you know, bleeding is a very common side effect of HRT, you can take 2 progesterone at night time, which is absolutely fine. Some people use it vaginally rather than orally. It's off licence doing it that way, but certainly our clinical experience is that if you use it vaginally, you get a better absorption into the bloodstream. It's used locally near the womb, and so some people find that their bleeding is more controlled if they use it vaginally, if they have bleeding. So if you do have bleeding abroad and you're thinking, oh, what do I do? You can increase the progesterone and it shouldn't have any problem. Sometimes bleeding can occur because the estrogen isn't being absorbed correctly, and that can be a problem, like I say, if the patches aren't sticking on so well, or your skin's really warm and you're absorbing more. Some people have bleeding because their estrogen level is low, sometimes because it's high, and sometimes it's just a fluctuation that can occur. Now, for those of you that are using the gel, some of you have asked what happens with sun cream. Now, usually once the gel has been absorbed into the body, then it's fine to use sun cream. And the manufacturers usually say between half an hour to an hour to wait. So if you apply your gel first thing in the morning, have your breakfast, whatever you want to do, pack your bag, and then put sun cream on it, that should be absolutely fine. Or you can apply the gel in the evening. Some people apply the gel twice a day, morning and night, and it might be when they're on holiday they decide they want to apply it all in the evening rather than doing morning and night, and that's absolutely fine as well. Or you might want to apply it in an area that you're not putting sun cream on. So the way the gel is licensed is to apply the gel on the outside of the arms or the inside of the legs. But there's nothing different about the skin on the outside of the arms or the inside of the leg. You know, you can rub it anywhere. We're just using the skin as a vehicle for the estrogen to be absorbed through. So if, for example, you were going out but you were wearing a t-shirt, you can rub it on your shoulders or on your lower back to get absorbed. And that's absolutely fine to do that if you would prefer to put it in a place where you're not putting your sun cream. So absolutely fine. The other thing, also thinking about hormones, is if you're using vaginal hormones, make sure you take enough. Probably too much information, but I use Prasterone, I've told people before, and I got one out the day before yesterday morning, and it popped out onto the floor and rolled under a chest of drawers. Well, I wasn't going to insert that in my vagina, so I had some spare, that's fine. But if you don't have spare, or if you don't have enough patches, for example, and then you find the patch doesn't stick on very well because you're hot, then it's really nice to have some spare. So I would take more than you think that you need. because what you don't want to do is have symptoms when you're away. And using vaginal hormones, certainly if I don't use them for a day or two, I will get cystitis. I'm far more prone to get a urinary tract infection, and the last thing I want to do is have that on holiday. So if you find that your patches are slipping and sliding and not sticking as well, then you might need to apply them more frequently, and that's fine as well. It's absolutely fine to go swimming if you've got your patches on. So you can still swim, you can still exercise, that isn't a problem at all. If you're sweating more, it still shouldn't be a problem absorbing the gel, because if once the gel is absorbed, it doesn't really come out as much. So I wouldn't worry some people asking about sweating. The other thing people were asking about is like, I don't really sleep well anyway, what am I going to do when I'm on holiday? And if my energy level's low, how am I going to cope with having energy to enjoy my holiday? And again, it's like I said at the beginning, it is a time for reflection. It's a time to be thinking, why am I more tired? A lot of us get tired on holiday because it's a time when we can just relax a little bit more. And sometimes it can feel quite overwhelming, everything that we've done in the past, and it's a way of our body just putting the brakes on and just trying to make you realise that you do need a bit of time to yourself and a time to relax. So it's not always related to hormones. But as many of you know, it's really important that you have an individualised dose and type of hormones. So our hormones, estradiol, progesterone, testosterone, all work very differently in the body. And they're all important hormones, they're all biologically active. And so sometimes people do need some more estrogen as opposed to progesterone. Some people really find that their energy improves with testosterone, others don't, because we're all different. So it is important, if you feel that you have more symptoms than you have done on other holidays, then when you come back from your holiday, it is worth addressing them. Speak to someone who really understands hormone and try and get that dose individualised for you. Really important. But also, it's a time thinking about what about your food, what about your alcohol intake, what about your exercise. Many people overindulge on holiday, and it can be so easy and so tempting to eat differently when you're away. Many of you know I suffer with migraines, so I can't eat differently. I'm really restricted with my migraines. So I can't have ice cream, I can't treat myself to a dessert, I can't drink alcohol because I know it will trigger a migraine. So I'm quite fortunate in some respect, but I look at my husband eating more when he's on holiday, drinking a bit more and thinking, so now he's got to lose a bit of weight. And he will do, and he'll exercise more. But actually, isn't it better to keep the routine up? As many of you know, I do yoga, so I take my yoga mat with me wherever I go, and I flick out the yoga mat in the morning, and most mornings on holiday I'll still do 15 to 30 minutes yoga in the morning, always ending on a headstand, and it's a really nice way to set up the day. And if you've got children, it's probably the only time of the day that you have to yourself, so that's why I prefer to do it, then have a shower, then have breakfast, and then I can just get going, knowing that if I'm away, I was away for 6 days, but I did yoga practice every morning, so that's 6 times 30 minutes. So I've done 3 hours of exercise, just as well as being on holiday. So it is worth doing, because otherwise, as you know, if you don't exercise, it's a lot harder to get back into the routine of things. So try and think about what exercise you can do, what good things you can still eat, but don't be too cruel on yourself either. I think having this sort of 80-20, where 80% you're doing the right thing and 20% you can let, especially on holiday, is absolutely fine. But it's really important that we do relax and connect with those who we're away with if we're going with other people, because so many of us, myself included, don't give ourselves enough time to switch off. And it will be no surprise for you to know that I was still working when I was on holiday, and actually I was doing a lot of work preparing for my tour that I'm doing in the autumn. And it was quite shocking. I've been reading a lot of medical history books. I've been reading a lot about the history of hormones. And for those of you that are coming to the tour, I think you'll be shocked too, some of the facts that I'm going to reveal. So I don't mind working on holiday. It's a different sort of work. I wasn't going through the emails in the same way, but I was still being very stimulated. And finding something that you enjoy, whether it's a talking book, whether it's a new podcast series, do something that is for you, because we do have to be a bit selfish as well when we're away. But obviously when we change our habits, especially when we're away in somewhere nice, then when we listen to that podcast again when we're at home, often we will be thinking about the holiday. And so it is important to just feel good about yourself. There's so many times that we come back from holiday feeling more exhausted than before we went away, because there's so much build up, there's so much preparation, there's so much anticipation, and no holiday is perfect. You look on Instagram and everyone's holiday looks absolutely idyllic, but of course you don't put on Instagram the arguments that you're having, the rubbish restaurants that you've been to, the times when you're all hungry and you don't know really where to go, or the trip that you decided to go on wasn't up to the right, it didn't live up to expectations. So don't be cruel on yourself. We're all human, and none of us have the most idyllic, perfect holiday with the perfect people 100% of the time. Or if you do, I think you're probably not being true to yourself. And we can't blame everything on our hormones, but there is a lot with hormonal changes. And for those of you that have teenage children as well, they will be having hormonal changes. And we shouldn't be underestimating them as well, because the more that I do reading and thinking about younger people who have hormonal changes, it can be really difficult for them. And we know how many people are on antidepressants who are young. And so many of these people, I think, is probably because maybe they're having hormonal changes, they're having PMS, PMDD that's not being diagnosed. And so if you're closer to your teenagers when you're on holiday, it's a time to really talk to them about, do they feel they have any changes in the way that they feel throughout their cycle, for example. And if they are telling you that they're feeling worse before their periods, whether they're getting worsening of their mood, or they're getting some physical symptoms such as palpitations or dry skin, or worsening of OCD, for example, then it's a time to really be thinking about hormones as well, what we can do. And many of you know I've spoken before, often we just give a low dose of hormones for those days when people are feeling a dip in their hormones. So speaking openly about how you feel is really, really important to your family or your friends who you're with. And making time just to connect and be open, because as you know, when we have hormonal changes, when we're perimenopausal or menopausal, we have to invest in our future health. We know there's an increased risk of diseases without hormones. And whether we take hormones or not, as we age, there's an increased risk of diseases. So we need to be thinking about how to improve our future health for the hopefully decades of life we've got left in us. And having a bit of headspace on holiday, we need to be thinking, are we doing enough exercise? Are we eating in the right way? Are we getting the right rest and sleep? Are we having a good routine? Are we happy with our relationships? Certainly on a holiday there can be this expectation that relationships with partners can be better. But actually sometimes it can be harder because you're often with children, or you might not be in the familiar surroundings that you prefer to be in if you're having a relationship with someone. So don't be cruel on yourself, but I would really use our holiday time to just think a bit more about, how am I going to spend the next 6 months or year until I next have a holiday? Am I going to be looking back at this time and be really proud of any changes that I've made? And most of us can't make big changes, but we can always improve what we're doing. But do small changes. Maybe think about changing the way you eat. I've said before, it's always easy to add something. So thinking about maybe adding some more foods such as nuts or seeds as a snack rather than reaching for a chocolate bar. Maybe thinking about what you're having for breakfast, maybe adding some more fruit to your meal or some more vegetables, so then you're not so hungry later. But thinking about what you can do and making it sustainable is really, really important. So there's a lot to think about, there's a lot to do, and I sort of didn't want to have this Instagram live just talking about hormones, because some of you listening might not be on hormones, or some of you might be, hopefully, like me and on the right dose and type of hormones. So holidays isn't just thinking about hormones, it's thinking about ourselves and it's thinking about our connections with others. I'm very fortunate, I've got a really lovely family and we're very open about things, and our holidays are a great time to reconnect, and I feel very sad that my holiday is over, but I'm very fortunate because I'm down in London with three of my children, so I will be seeing them this week, but I will still be working, so it won't be quite the same time that I had. And I always come away from holidays feeling quite regretful that I didn't spend more time, that I did do too much work, that I should have switched my laptop off a bit earlier, that I should have had more conversations with my husband rather than going on my phone. But he knows I'm not going to change, and it's very difficult to change. But the important thing is to feel good about yourself, and that's really important. So have some time for yourself. Think about your hormones. Think about, could your dose type of hormones be optimized, improved on? Download Balance if you haven't, because it's free. You've lots of information there. Our website, balance-menopause.com, has longer articles, more information there, and obviously is my book. And hopefully some of you will be booking for the tour. I found out the other day that Bristol's already sold out, so I'm sorry if you want to come and see me in Bristol, but the other venues are selling fast, and I think they'll sell quicker once people are back from their holidays. And I'm really looking forward to listening to your response about some of the things that I'm going to tell you on the tour, because I want you all to learn about the injustice of what's been going on for women for centuries, actually, to stop us having our hormones and our health going forwards. So I hope you've enjoyed this. I hope you've learned something. I'm going to put some resources on my story in the next few minutes, with links to, that hopefully you'll find interesting, and look forward to speaking to you next week. So enjoy the sunshine for those of you that are in sunshine. Hopefully have a great week and enjoy every moment of what you've got. Thank you.